ready, Charlotte? Good. Welcome to Press Club of Baton Rouge. I'm two representatives of the new publicly funded Bridge Center for Hope. This new center operates 24/7 as a safety net to aid individuals in crisis and is located on Florida Boulevard directly across from the Baton Rouge General Medical Center. We welcome Charlotte Claiborne, the Executive Director hired by the Bridge Center for Hope Board of Directors in October of 2019. Ms. Claiborne oversees and manages all contracts, including the services contract with Recovery International, often known as RI. She has MA degrees in management and in healthcare management, and she will introduce the RI representative, Lysha. Thank you.
Good afternoon. Thank you for having us. Oh, yep. I need to get to the mic. I can't see my screen this way. And I'm short. Can I stand right here just so I can kind of see out? That's okay. 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 Good afternoon. I'm Charlotte Claiborne. Thank you for having us. Along with me is Lysha, the State Director for RI International. For those who are not familiar, RI International oversees the programs and services at the facility. So this is hard because I can't see what we're doing there. No, I can click. So here's the thing. Let me roll myself just. Y'all edit this part out, okay?
Just that light.
You're good? Okay, thank you. That helps so much better. So one of the things that I wanted to discuss is to understand the purpose of the Bridge Center for Hope. You have to understand the need for crisis care facilities in the United States as well as Louisiana. So if you're going to do that, you have to kind of go back. And to go back, you have to start with the 1950s where they started deinstitutionalizing state-run mental health facilities. And when you did that, it allowed for individuals who were being discharged from public psychiatric hospitals that it didn't ensure that they had appropriate medication and rehabilitation services. And so it left them in one of three things. It left them either untreated, undertreated, or self-medicating. And so currently, right now, Louisiana only has 2 state-run mental health facilities. One is called Central, which is in Pineville, Louisiana, and the other is East, which is located in Jackson. And to give you a little perspective right now, there is a 4 to 5 year wait time frame for anyone who's having a chronic mental health illness that needs chronic long-term care. Those are the only 2 state-run facilities that we have. So if you start and take the 1950s and you kind of fast forward to the early 2000s, there was a hospital called Earl K. Long, and I know you all are familiar with that. And Earl K. Long had a mental health emergency room extension at that facility. And what that did, it allowed first responders and family members to bring individuals to that facility who were in a mental health crisis. Well, that facility closed in 2013. And when it closed, it left about 2,000 people annually who were going to that facility nowhere to go unless it was either parish prison or it was the local emergency rooms at the other facilities. In 2015, Baton Rouge General closed. So now you have the individuals that Baton Rouge General Mid-City campus was seeing, plus those that Earl K. Long were seeing, plus an increased number of individuals who were needing mental health services, looking for some place to go. So as a result, the number of individuals who were needing mental health services were rapidly increasing, and they only had 2 options. And those 2 options were an expensive emergency room department or to parish prison. So what we've learned is we needed to do something. And when I say we, I mean the parish, the city, the state, everyone. But the Bridge Center for Hope was birthed out of needing to do something. for those individuals who were suffering, and to act as a diversion to parish prison and or the emergency room departments. So in 2016, we went, and I say we, I mean the Bridge Center for Hope, we tried to get a parish funding, a parish tax, and it didn't pass. So we went back in 2017, hired Emergent Method, had them do some research and some analytics to go back to the community, explain the purpose and the need for it. And we went back and put it on the ballot again. And that parish tax passed in December of 2018. So as a result, you now have what is called the Bridge Center for Hope Crisis Receiving Center facility. That facility is designed to provide crisis stabilization services for individuals in East Baton Rouge Parish 18 years and older. I wanted to take a moment to give you a little bit more perspective, because when we talk about numbers and we talk about statistics, we never really hone down on what that means for East Baton Rouge Parish residents. So if you look at this chart, that chart represents OPCs, and what that means is Order of Protective Custodies, and that CEC represents Coroner's Emergency Certificates. All of this is mental health cases. So if you look at it in 2011, there was 473 OPCs, 3,152 Coroner Emergency Certificates. And then you can see how that number continually increases each year. Right now, in 2021, if you look at the number from May, there was 3,214 CECs. That's more than what we had in 2011, and that's not even halfway through the year. We also have 526 OPCs. Now, I'm not sure if this crowd or this room is familiar with the OPC and the CEC, but what that does is if you find someone who is either a danger to themselves, a danger to others, or gravely ill, then you can do an OPC on them. They don't have to be related to you, but you would have to go to the coroner's office. And Louisiana is the only state where the coroner will be able to do that. No other state allows their coroners to do a coroner's emergency room certificate. And what that does is it puts someone in, it makes them involuntary. So you have to have a CEC and a PEC. And what that PEC stands for is a physician emergency certificate. So before someone becomes involuntary, two doctors has to examine that person. So it can't be just because I said it, that person can be involuntary. It has to be me and someone else. So I just kind of want to make sure you understand that little aspect of how a CEC and an OPC works. The next graph talks about the substance use crisis that we have here in East Baton Rouge Parish. That blue represents the number of fatal overdoses we've had. So you start in 2015, we had 78. Currently, right now, as of June of this year, we have 115. That green number represents the non-fatal. We don't talk about the non-fatal because we only talk about the fatal in the press, but there is a non-fatal number. There are people who were able to survive. So if we start at 2018, it's 688. Look at 2020. There were 1,410 non-fatal overdoses. Right now, we're at 718, and this year is not even over. So we're on track to either equal or surpass the number for 2020. That lets you know right now, if you take the number of people that are suffering from mental health services and the number who are suffering from substance use issues, then that lets you know there is a need for mental health facilities such as the Bridge Center for Hope. So one of the things that the next slide represents is it's a video that shows, the next slide represents a video, but I wanted to explain to you why the Bridge Center chose RI International. In August of 2019, we selected them based off of a national search. We did a solicitation of proposals across the country looking for a provider that could provide crisis services, that could start boots on the ground running, knew what they were doing. And so when we did that national search, we searched a high and low. We had a couple of respondents, but RI ultimately won out. And what you need to know about them is they've been doing this for 30 years. They've been providing crisis care services for 30 years. They are in 14 states? 9 states. Okay, 9 states. I'm trying to give them more states. 9 states, and they're also in Australia and New Zealand, so hence the international part. But they have been doing this services for for the longest time, so they know what they're doing, which is one of the reasons why the Bridge Center chose them. Another reason why the Bridge Center chose RI International is because of their Crisis Now approach, and you'll see a video of that in the next 2 slides, and Lysha will be able to explain a little bit more about that as well. So this video kind of give you a brief overview of the Bridge Center, what the facility looks like, and then kind of the story that I just gave, and it kind of puts it all into perspective for you. Well, that didn't work. Let's see. Hold on. So that video gave a brief overview of the facility, what the facility looks like inside, the different units and the programs and services that are offered. The next video discusses the Crisis Now model. That is a RI International model that was sought high from the Bridge Center Board of Directors because we wanted to make sure that whenever someone came in to the facility, they were immediately seen, and that model represents that. So it's proven, it's evidence-based. It is been in existence for how long? A long time. Okay. So this is the quick. So you have an overview of what the services are needed here in East Baton Rouge Parish now more than ever. And if you looked at it from 2011 when the emergency room extension was open, those numbers were decreased and then rapidly increased over time. You also understand that we knew that there was a need, there was a cry for help, that somebody had to do something. So the Bridge Center Board for Hope nonprofit reached out to try to figure out how we can bridge that gap. To understand that we are the only crisis receiving center in the state of Louisiana. There is not another crisis receiving center. So we're setting the standard, but we're also trying to make sure that we provide services for our residents here that are in a mental health crisis, for them to be able to have somewhere to go, whether they come on their own, whether it's escorted by a loved one, or if they're brought in by first responders. The next few slides, this is going to show the Bridge Center for Hope, where it's located at 3455 Florida Boulevard, across the street from the Baton Rouge General. The next few slides, Lysha is going to explain each one of the units that we have at the Bridge Center for Hope and the programming services that the facility provides.
Hello, everyone. So like Charlotte said, my name is Lysha Bess. I'm the Louisiana State Director for RI International. So I moved here to Louisiana to open this facility here. And so we were, as a company, we were excited about the Bridge Center for Hope because it was needed in East Baton Rouge Parish. And so what you'll find and what I'll go through today is really about the services at the facility and how people you come in contact with will interact with the staff at the facility. So basically, I would like to start with our facility has a no wrong door approach. So no wrong door means that we don't turn people away that's in crisis. So if the facility is primarily for East Baton Rouge Parish, but if someone is from a different parish and they're having a crisis here in this parish, they could come to our facility. We would get them situated within that crisis and then get them back to their parish of residence. That just means that people that are in crisis should not try to figure out where they should go to receive services. And we also don't have any type of list or anything, so anybody could come back as many times as they need to receive services. So here's the overview of the facility. And so our facility is about 26,000 square feet. We have 4 units and 6 programs within that facility. If someone comes in with a loved one or voluntarily, they will come in through our main lobby. If they come via law enforcement or first responder, they will come in through our law enforcement entrance, which is at the back side of our building. So our first unit is called our 23-hour crisis stabilization unit. RI International calls it our retreat unit. So this unit is where everyone starts. So when they come into our facility, everyone will start on this unit. We have 16 recliner chairs on this unit. It's set up for optimal observation because in the first 23 hours, we really need to figure out what the crisis is and how we can best help that individual. We do call the individuals that come into our facility, we call them guests and not clients or patients because we like to feel like they're at home with us. So we do call them guests when they come in. So every guest that comes into our facility, they start at this unit. Over here we have psychiatrists, psychiatric nurse practitioners, RNs, LMHPs, so LCSWs and LPCs, certified peer support specialists, and then milieu specialists. They would receive a clinical assessment, a nursing assessment, a psychiatric evaluation, and then they also do individual and group therapy on this unit as well. So within the first 23 hours, we decide what happens with that individual after the assessments. Then if they need a longer term stay, longer term for us is 3 to 7 days because our facility is a short-term crisis facility. So after the 23 hours, after they've been assessed and we feel like they need to stay with us for a longer time, they will go to our short-term psychiatric unit if they have a psychiatric diagnosis. Over here we have 16 beds, so it's 8 double occupancy rooms. And then we have the same staff as we have on the other unit. So psychiatrists, nurse practitioners, nurses, peer support specialists. Over here they have a robust daily schedule. So they do about 5 groups a day. They meet with our nurse practitioners daily, also meet with the licensed mental health professionals daily, and their peer support specialists. We do art therapy, music therapy as well on this unit to make sure that we're meeting their needs. After the 23 hours, if the person needed detoxification, they will go to our 16-bed substance use medical detoxification unit. Over here, we have 7 double occupancy rooms and 2 single occupancy rooms. We have the same staff on this unit, except for we would have to add an addictionologist who specializes in addiction medicine for this unit. They also have 4 or 5 groups a day, daily treatment sessions with their providers. Usually at our facilities, we have an area to go outside, but because where this facility is located and where the citizens wanted the facility to be, we were able to create some type of patio area. So on this unit, they have a patio that they can go out and get some fresh air as well. Our last unit is our 16-bed center-based respite unit. So on this unit, individuals will go over there if they need some type of respite away from their living situation so they don't go into crisis. So sometimes people don't always live in the best types of situations. So if they have a provider or if they're at the hospital, they can do a referral to this unit, and they will come to this unit for about 7 to 10 days to have some type of respite away. This unit is our lowest level of care. So over here, we only have certified peer support specialists, and they work with them on independent living skills, work with them on applying for jobs, or if they don't know how to wash their clothes, and also they do some financial management as well. Our last 2 programs, we also have a care management team. So our care management team functions as like a discharge planning team. So it's a 2-person team, a licensed mental health professional and a certified peer. And they work across our entire campus to make sure people have good discharge plans when they leave. So they make sure that everyone that discharges have a mental health or substance use appointment, and then they also have a physical health appointment as well when they leave. And we're also able to follow them in the community for up to 30 days. So we have a warm handoff from our facility to their next step, whatever the next step may be. We will follow them until that appointment. Because what we found is that if we don't do that warm handoff, some people get lost in translation. So we want to make sure that we're able to get them from us to the next person very safely. And lastly, we have a mobile response team. It's a 2-person team again, a licensed mental health professional and a certified peer support specialist. We will go out into the community once we're dispatched from 911. So the communications will send us a dispatch of someone that called them and that are in crisis. We will respond to that call, and we will try our best to mitigate the crisis in the community, but if they're unable to, they can transfer the individuals to the facility. Oh, I think Shaw's going to go through the stats here.
So I think this is what everybody wanted to understand. Is how is it working, since we've been open. So the Bridge Center opened on February the 11th of this year, roughly at 10 a.m., and then we had an ice storm 2 days later. But we survived. So since that time, we've been open 159 days, effective today. We've served 829 guests as of June 30th. So right now, today, we probably are at 1,000. 58% of those individuals have come in independently on their own, meaning they've either came with a loved one or they came on their own seeking services. 48% was escorted by first responders, and first responders can be law enforcement or it can be EMS. Baton Rouge Police Department accounts for 66% of our escorted first responders, where EMS accounts for 21%, and the numbers kind of go down from there. 87% of the individuals that have come to the Bridge Center are East Baton Rouge Parish residents, and 13% are out of parish. And so what I want to clarify for that is that for those out of parish residents, the Bridge Center for Hope acquired a grant from Humana to be able to fund those individuals. So if they come from out of parish, we still have a grant funding to be able to take care of those individuals as well. Lastly, 51% of that 829 sought mental health services, and 49 for substance use. And then you have some dual that were doing mental health and substance, but I don't have that broken out in that regard. So, again, I'm Charlotte Claiborne. This is Lysha Best. Questions? Because I know we have a lot. Go ahead.
I have a question in regards to if some somebody does go to your facility via first responder, sheriff's department, and it is obvious that they need longer term care, what are the steps if they are not voluntarily seeking that longer term care? Do you guys contact the facilities where they need to go? How does that work?
Yeah, so I think everyone that comes into our facility as licensed professionals, we have to evaluate them to see what the best course of action is. Some people we would have to involuntarily commit them to our facility because they either want to leave and we don't think that it's safe for them to leave. Then we would commit them to our facility and then try to figure out where they should go from there. But the person has to be a danger to themselves, someone else, or gravely disabled for us to meet the criteria to make them involuntarily stay at our facility. And that decision is based on what they're presenting with at that moment. Most times we're able to call family or friends and get collateral information, but it's really dependent on what they are presenting with at that time that we have to make that decision. No, yeah, follow-up question.
I guess the follow-up question would be, if somebody were in that position to where they were evaluated more than once,
Mm-hmm.
and they ended up at your facility, how do you reach out to persons who have some kind of documentation on past behaviors? How do you know to do that in order to make sure that person truly gets the care that they need?
Yes. So unfortunately, HIPAA rules doesn't allow us to do that. It has to be that individual giving us permission to do that. Unfortunately, because we can't just call people. So we try our best and we talk to them through assessments and talk to them about where have you been, how many places have you been, do you have family members that support you, are you okay with us calling those individuals? So we try to get that information, try to get them to let us know that we can call them so we can gather that information. But it's really up to the person to give us permission to make those calls on their behalf, unfortunately. Yes.
I noticed that 66% of guests arrive via Baton Rouge police.
Mm-hmm.
Who makes the evaluation to go to the Rouge Center in the first place?
Yeah, so we have meetings with law enforcement officers all the time because the facility is set up to be a diversion from hospitals and prison. So we want them to bring them to us instead of taking them to the hospitals or to prison. So we're building that relationship and making sure that they understand that we have a no wrong door and we don't turn law enforcement away. So we don't want them to make a decision in the community. So if they come in contact with someone and they feel like they need some services, they can bring them to us and we will figure it out.
So it's up to the law enforcement
It is.
officer.
Yep.
Do you have any special training for them?
Yes.
Yes, we do.
Yes.
Mm-hmm.
For Baton Rouge Police Department, they go through a training called CIT training, Crisis Intervention Training, which is done by Capital Area Human Services. It's a 40-hour course that they go through. The Bridge Center represents maybe a couple of hours of that training at the end. So they have that training. Sheriff's Office has it too, but it's not mandatory. But it is mandatory for BRPD. So they do have that training to go through to be able to help them make better decisions when they encounter someone that may be having a crisis.
Yes, because they don't always know what's the best course of action. And that's why we've always set up for them to just bring them to us. Even if you don't know what it is, we will figure it out, because what we found, if we put too many obstacles for them in the community, they're going to start triaging and deciding for themselves. So we just want them to bring them to us, even if it's mental health, substance use, or maybe not. Just go ahead and bring them, and we'll figure it out, because we are the specialized individuals.
One of the things that we talk to law enforcement about is I call it stop drop. I call it stop drop and roll. Meaning you stop at the Bridge Center, you drop that individual off, and then you roll on, because our goal is to make sure that they get on with their day. One of the things I didn't put in statistics that RI is wonderful at doing is getting law enforcement in and out. And right now their average time is 3 minutes and 71 seconds.
Yes. So we always, as a company, we quote that we can get law enforcement officers in and out of our building in under 7 minutes. And so right now we're at about 3.71 minutes. We're able to get them in, drop the individuals off, and then get them back to public safety.
Could you explain your relationship to, I think you mentioned Capital Services and the detox center on Foster Drive? This weekend I noticed that there were no cars at the detox center on the weekend, and there used to be cars there all the time. So
Yeah.
is there some sort of synergy that you have between those other two?
On Foster Drive, is that Baton Rouge Detox?
Is that Baton Rouge?
Okay,
They're closed.
I think.
That's the old,
Is that Baton Rouge? That's the one we just talked about. So, you can talk this in a minute. They're closed. That facility is no longer open. So that's why you're probably not seeing any
so
cars
my
there.
question, Charlotte, is that the only, are you all now the only detox?
No, we're not. No, we're not the only detox center. We
Okay.
do provide detox services, but we're not the only one.
Okay.
Baton Rouge Detox was one of them, but we're not the only one.
So your follow-up question is, did they answer?
The Capital Services.
Capital Area Human Services. Oh yes, so we would use them. So our facility is inpatient, and so our care management team, making sure that people discharge with appointments and stuff. We work with our resources in the community to make sure we have appointments and stuff with our outpatient services. So that's how we interact with Capital Area Human Services. They provide us appointments and stuff for individuals that discharge and they need follow-up care.
And your total budget, annual budget?
The tax is
So the tax budget is about $6 million, but it's not funded strictly by the tax. It's also funded by insurers too.
yes.
The tax passage covers the indigent population for those who do not have insurance at all, or who's underfunded with their insurance carrier.
Any more questions?
Charlotte?
Yes, ma'am.
I wanted to know about do you have a medical director, a psychiatric medical?
We do, yes. Our psychiatrist is our medical director. His name is Dr. Gadd out of Lafayette. GAD.
Is he on the premises?
Yes, mostly, and he also does telehealth as well. And so he oversees all the services at the facility in regards to medical, and then he's the supervisor of our nurse practitioners.
I wanted to just applaud you for what you're doing. This is so needed for so long. And so my question is, what does the public need to do to support you? And my second question is, I know that you're serving a greater Baton Rouge area, not just the parish, but is something like this planned to be copied for other parishes or other parts of the state?
So to answer the first question, the main thing that we ask the public to do is to educate themselves on the Bridge Center for Hope. And to do that is to go to our website, brbridge.org. It gives all of the units, it explains who RI is, it explains how we started, the services that we offer at the facility. The other question, to answer your other question in terms of out-of-parish residents, because we're the first to do it, we do have parishes looking at us. We do have people coming asking us questions, RI as well, because they're also a nonprofit. So we do anticipate that there are going to be other crisis receiving centers opening, but they're going to probably wait a couple of months or maybe a year or so, because right now, by it being in the beginning, there are no crisis receiving services for Medicaid. There's no rates. So we're having to go around about it to fund the facility for us, but in 2022, those rates should be published, and so you may start seeing some more facilities open up. I can tell you this, that St. Tammany has a crisis receiving center that they have built, but they have not opened. So I'm assuming they will probably be the next ones to open. Yes?
That was going to be my question. So there are more centers like yours coming online in Louisiana?
As of right now, the only one that I know of is the one in St. Tammany Parish. I do know that Louisiana Department of Health is going to limit the number of crisis receiving centers that they have to, because you don't want to have so many. You don't want to have it saturated. You don't want to have it saturated, and they probably have some other reasons behind it. But I do foresee that there will be some more in other parishes. Yes.
And the one in St. Tammany Parish will not be run by RI International. That's a different company, so they'll probably have a different model.
Yes.
I'm just curious if there's a 4 to 5 year waiting period, if there is such a thing as saturation. You know, if there's a 4 to 5 year waiting period
saturated with the chronic, mental illness population, because that way we wouldn't have a 4 to 5 year waiting period. But we had several hospitals that closed starting in 2009 up until 2013. So it left us with the last 2 that we have.
I think that's definitely something that as a community we need to work on and continue to talk to whoever would listen, that we've got to do something different in regards to mental health.
And that can also be something that the community could say, we need more long-term care because we don't have it.
Yes.
And that's a need.
What? I'm sorry, excuse me.
I'm not really
No,
legal
you
with my
but you've been
question.
trying to. What is your average number of guests per night, and what percentage do you see come back?
Yeah, so average, let's see. I would say we have about 35, 40 people out of 64 beds. And so that's around our average. We don't want to get at 100% because that means we'll have to say no to people. So we try to stay around 85% of capacity so we can continue to move people through the process. In regards to how many people coming back, our recidivism rate, we try to keep it under 10% because if people are continuously coming in, although we would never say no to them, that means we're missing something or they're not getting something. So if they're coming in, we try to do our treatment team meeting. So that means that we will bring together their outpatient provider, us, or whoever else, their family member, natural supports, to come together to try to talk about what their needs are and how we can best work together to meet those needs if they're continuing to come back.
Do you feel like with that number, if you're only getting 10% coming back,
Mhm.
do you feel like that other 90% are being treated the way they need to be treated, or really?
Yes, they are. Yes, they are. This community, I'm from North Carolina, so coming here to Baton Rouge, they've been very welcoming to us, and the resources has really been amazing in regards to discharge plans, where they would go from us, because our facility is only 3 to 7 days. So we really rely on the resources in the community to get them discharged appropriately.
So one of the things that Lysha and I did before the facility opens, we went around to all of our outpatient providers. I'm sorry. One of the things that Lysha and I did before the facility opens, we went around to our outpatient providers to educate them on what was coming down the pipe, what the Bridge Center for Hope was, what RI International was going to do at this facility, so that we had all buy-in at the beginning, so that when we opened, it wasn't something new that they just never heard of. They knew exactly what to expect. We try to have those interactions early on, so that when we open, we knew that we can hit the ground running with that.
What about those families that are still struggling with mental health, loved ones and friends who won't come to the facility or haven't come to the facility yet, feel like they're lost? What is your message to them?
Yeah, absolutely. I think with us going out, we've been going to what are they called?
Community events.
Yes, we're going to community events, so we try to get out there as best as we can to give out those flyers and talk to anyone that would listen to us, that they can come to the facility at any time. And then also, people that come into the facility, if they're struggling with their family or a family struggling, we also would provide some family sessions. The family can come in and visit with the individual that's there, so we can kind of coach them through what they should do when they leave from us. So we want to make sure that we're going to those events and talking through with the people in the community to know that it is available whenever that person is ready to come into the facility.
So what we've done starting on June, we had a community event called Bridging the Gap. And so we've tried to go to each district to educate each district on what the Bridge Center for Hope is, the services that we provide. We've gone to about 5, so we have about 7 more to go. But the whole goal of that is to provide education and awareness. So the more that you see us, the more that you hear about us, the more that people become aware of the services that we provide. Even if it's just in passing, they say, "Oh, I've heard about the Bridge Center for Hope." Wait, and then they'll intrigue their interest for them to be able to go and learn a little bit more about the services that we provide. Because it may not necessarily be you, but it may be somebody you know. It could be a family member, or it can be somebody a coworker that you're talking to in passing. That, and you know, this happens all the time. You see something and you put it in the back of your mind, and then it comes later. You're like, "Oh, I read about that." So that's our goal, is to provide as much education and awareness that we possibly can about the services that we have, because we don't want anyone in the community to think that they're out there lost, like you just said, or family member to feel like they have no resource for them to come. Because we're open 24 hours, 7 days a week, and RI has the no wrong door policy, they're not going to be turned away, even if it's for just resources.
Yes, we want to be a pillar in the community. So sometimes people just use us for resources. Sometimes they just come, or they give us a call. They don't know what to do. They don't know if this is the right place. Should they come? Should they not? And we're always available. Someone's going to answer the phone 24 hours, or you can come in and we'll give you those resources as well.
My question was about children. I know you can't help children. Where do you send people who come to you?
We haven't had anybody come to us that was under the age of 18. We've been no teenagers. Mm-mm. No, we haven't had that issue.
The psychiatrist, I think that we asked about earlier, from Lafayette, is that the only one that you're working with, or?
He's our medical director, yes. And then we have a chief medical officer for our company that oversees every site. But yes, the psychiatrist.
Is that detrimental having him in Lafayette and you in Baton Rouge? Or?
No. He comes to the facility when he needs to, and then he's always available. He's available 24 hours when the nurse practitioners need him. Yes.
I know the question isn't something that's really in your purview, but in the light of the surge in the virus right now, are y'all doing anything since you're meeting outreach to encourage vaccination?
We do. So when individuals discharge from us, we give them vaccination information. If they're interested, we help them set up appointments and such like that. We work with Baton Rouge General Hospital. They have their vaccination clinic. So we want to make sure that we educate all the guests that discharge about the vaccination, yes. And we encourage our staff as well. That's it.
Thank you so much.
Thank you for having us.
Thank you, guys.
You get to say all the degrees you have.
Oh, no. Sorry. Next time
Because I was so impressed. Oh, I'm sorry. Yeah. Excuse me. We will have the Lieutenant Governor